Thank you all so much for joining us here. Those of you who are on a little bit early, I'm going to be covering some agenda, some housekeeping items, some general expectations for what to expect in the session today and how you can interact with us. I'm going to start by saying that this is our most registered webinar ever. We've got roughly 2,500 people that signed up for the session today. And usually when that happens, it's a little bit more likely that you can sometimes have a little bit of slow performance when it comes to the video streaming or the screen sharing. So just be gracious with us. If you're having any issues, feel free to let us know in the chat if there is a major problem. I'm seeing some emojis pop up there, so hopefully you can all hear me okay. I'm seeing a lot of people chatting in, looks like from all over the country. See Washington State, Nashville, Alabama, New York, Arizona, California, Miami, Puerto Rico, Texas, Springfield, Missouri, Idaho. So North Carolina, Illinois, Milwaukee, the Philippines. Wow. So we got people all over the world on the session with us today. This is probably our most popular webinar that we do every year. And so I think the reason why we tend to draw a big crowd for this one is because we try to make this session particularly as practical as we can, because what we're going to be doing today is giving you actionable insights based on data from just this past year. So we're going to be reviewing published fines, key breaches that have happened throughout 2025, giving you kind of the current state of compliance as it stands in the US, regulatory insights. And our goal is that each of you come away from this session today with something that is actionable and applicable to you, that you feel like this is actually something that you'll have some good takeaways from this session to bring back to your organizations. And with all that said, a couple things to keep in mind as we're going through the session today. We have a very active chat today, which we appreciate. Love the interaction from everybody. But if you have a question, because we have so many chats that come in, please direct your question to the Q&A feature, okay? Those questions are captured separately. It's a little bit easier for me to go through and review them. And you'll notice as well that when you ask a question in the Q&A section, it can be upvoted. So all of you who are on here, if you go to that Q&A section now and you see a question that you had as well, you can ask it and it can be upvoted, and you can upvote other people's questions as well. So 2 questions that we get all the time is, will the webinar be recorded and will we have access to the slides? Absolutely. Usually within 24 to 48 hours of the end of the session, you will get an email sent to you with a copy of the recording and the slides that you'll be able to access. That'll come directly from us. So you can expect to see that pretty soon. Okay. The other thing I would say is that we do lots and lots of these webinars. There is tons of free educational resources, both past webinar recordings, things like compliance checklists, white papers, great articles, all on compliancygroup.com. Tons of free resources available to you on there. So I would encourage you to check that out if you're interested in getting access to more of this type of content and would like additional feedback or insight. Okay. With that said, I like to kick off all of our sessions with a little bit of a poll. The first poll that you're going to see pop up on your screen is just scale of 1 to 5. How comfortable are you with compliance-related topics, let's say? We have a lot of people that join these sessions that are brand new to compliance. We have others of you that I'm sure are career compliance officers that have been doing this for large organizations for a very, very long time. We tend to have a smattering of familiarity, and it seems like the overwhelming majority of you are 3 and up, which is nice to see. For those of you that are at the 2 and the 1 phase, rest assured there will be a lot of good stuff in here for you as well, okay? Those of you that answered with a 5, very bold. I like it, very confident, okay? This just helps us get a gauge on the experience level that we have within our audience. Knowing that many of you at least have a moderate degree of experience when it comes to compliance, that helps me just make sure that we're tailoring the talk today to make it applicable to kind of the broader audience that we have. So I'm going to go ahead and close this and take it down off the screen. The next thing that we're going to ask is about the size of your organization. As I'm sure you know, compliance for a 1 to 5 employee practice is going to look radically different than if you're 500 to 1,000 employees. And so you'll see this pop up onto your screen now. Really, again, just helps us make sure that the content that we're discussing today is as relevant as possible to the audience that we have included in the session. It looks like, uh-oh. I think my slides just died on me. Can everybody still hear me? Must just be my slides. Yeah, Google Slides just totally crashed on me on all my screens, so I'll have to get that back open. So from what I'm looking at here, the majority of you looks like are in that 500 plus employee zone, at least in terms of each of these buckets. Probably the overwhelming majority, though, sits somewhere between 5 and 500 employees. So we'll say like 25 to 500 employees. So we'll go ahead and close this poll now. Again, that's all just like helpful information for us to know. Seems like a lot of you are in slightly larger organizations, but also then many of you are in smaller organizations. And so we want to make sure that this is as relevant and applicable as it can be. We have a couple of our folks backstage today. Joey and Ryan, can you still hear me okay? Just to make sure. All right, I'm getting some applause. There we go. So let me go ahead and just reshare my screen. Google Slides very abruptly died on me there. All right, thank you so much, everybody. Appreciate it. So with all that said, thank you all for participating in those polls. We're going to go ahead and get started with the session here now. As we're going through, again, please, I would encourage you to use the Q&A feature. I will not be probably answering questions throughout the entire webinar as we go. But then as we move along here, I'll take breaks and we'll go through some questions relevant to the topics that we're covering in the session today. Okay. So with all that said, let's dive in. Want to give just a quick little bit of background on Compliancy Group. So Compliancy Group, just so y'all know, we have a 20-year history as a company. We work with over 4,000 organizations all throughout the country. Our focus is and has always been healthcare compliance. And our goal is to help every single one of our customers make meaningful strides towards ongoing healthcare compliance outcomes and strategies. And our goal in these types of sessions is really just to share some of the wisdom that we've acquired in the last 20 years of doing this. We have never in the history of our company had a customer fail, particularly an OCR HIPAA audit, an investigation, or be fined. We've supported our organizations through hundreds of those. The topics we're covering today are going to be specific to things like OCR audits, HIPAA investigations, things like that, okay? With that said, our goal is to share some of that wisdom. We've had a lot of success. We've had hundreds of our customers go through an actual OCR audit, an investigation. We've not had one that failed or was fined, okay? Want to give a special welcome to our many association partner members. Many of you maybe heard about the session today through one of our association partners, like the HCCA, the ADA, AAOS, the American Med Spa Association, American Academy of Pediatrics, the American College of Healthcare Administrators, all assisted in promoting this webinar. So we hope all of you joining from our association partners get a lot out of it today as well. First thing we're going to do is we're going to start with some general compliance basics. So for those of you that are in that phase where you're like, hey, I'm like a 1 or a 2 on the confidence in my compliance stage, a lot of the opening items that we're going to be covering here will hopefully be particularly helpful for you, but I think something for everybody here. And one of the main challenges that we often run into with any of the organizations that we work with is that healthcare compliance in general is just a beast, right? So this is a mind map that we used an AI tool to create that just highlights all of the different potential intersecting points that could contribute to your internal compliance programs, ranging from HIPAA privacy and security to clinical and quality and safety and Medicare standards, fraud, waste, and abuse requirements, CDC guidelines, ADA compliance. There's so much that you could talk about when it comes to healthcare compliance. We are going to be very specifically focusing on privacy and security requirements today. That's what a lot of the content is that you'll see what we are covering. And I want to just quickly set the stage for those of you that are new to this, is that frequently newcomers to compliance often have something specific in their mind that they think of when they think of compliance. And on the screen here, what this is the 7 elements of an effective compliance program as defined by HHS as well as the OIG. And these are basically the boilerplate expectation of what they say you ought to have included inside of your compliance program as a company, regardless of what we're talking about. Okay. So whether it's HIPAA, whether it's OSHA, whether it's fraud, waste, or abuse, whether it's clinical, safety, quality, doesn't matter what it is, all 7 elements here are applicable. And I think what sometimes happens is companies think about compliance, especially when you're new to this, and they have this kind of point and shoot mentality when it comes to these things, where they say, oh, well, I need to train my employees, so let me really just figure out a way to get all of my employees trained. Or maybe it's they're thinking of policies and procedures. And if you're in a small practice, maybe your policies and procedures is just like a binder that sits in the back of somebody's office. Or, oh, we need to do a HIPAA risk assessment, or we have all of these incidents that need to be handled and managed. And that approach to compliance can sometimes create risk in and of itself. Because over time, what you wind up collecting is a lot of those point and shoot types of processes and systems, when really all of these 7 elements are meant to connect together in a way that is cohesively managed as one compliance program. So the first thing I would say to all of you is, if you're looking at a piece of this and you say, oh, well, HR handles that, I don't need to worry about that, or IT handles that, I don't need to worry about that, that's kind of a dangerous place to be when it comes to your organization's compliance and your oversight of it. When you're looking at this, it's important to understand to start that you should have oversight and involvement in all of these areas as it concerns your compliance program. And one of the things that we will consistently see as we go through the session today is that there's certain things that are often highlighted as being a key deficiency of the compliance program, but it connects to everything else that you do. The main thing that you will hear us talking about today, and what was cited in 95% of the published fines from Health and Human Services last year, is risk assessment. Roughly 80% of all of the OCR fines, that enforcement effort was kicked off as risk assessment deficiency being the core legal basis for their enforcement. 95% of the fines that were levied mention missing risk assessment documentation generally. Why is it that risk assessment comes up so often as it concerns these types of fines and scenarios? And I think when people think about risk assessment, they sometimes think IT. And especially as it concerns compliance, risk assessment is not an IT function. Actually, the overwhelming majority, let's say a HIPAA risk assessment as an example, the overwhelming majority of a risk assessment for HIPAA is going to touch on topics that pertain to every single one of those 7 elements that we just looked at, ranging from policies and procedures to employee training to, yes, technical safeguards that might need to be in place, how you're handling incidents, how you're interacting with your vendors, how you're documenting those efforts on an ongoing basis. And so for many of you, the challenge that you're going to face is that if your risk assessment is living in this place that's like completely disconnected from everything else that you're doing as a company, you not only have a challenge in illustrating the completion of that assessment in the way that the government wants to see it, you're going to have a challenge then downstream illustrating all of those other efforts, because it's fractionally managed and it's disconnected. Okay. So that siloing of the program, especially as it concerns your employees, is one of the biggest risk areas that I want to highlight for everybody today, especially considering the enforcement initiatives we're going to be covering. Because if you have policies and procedures in a drive or in a binder, and then trainings in an LMS, and then incidents in your inbox or in a file cabinet or in a separate system, and then you're doing things like employee exclusions on top of that in another system, it's impossible to truly be audit ready, because it's like when something goes wrong, the scramble begins to actually figure out where all of this documentation is housed. So the thing that I always encourage people to think about is, how can we consolidate our processes, break down those silos, so that we're connecting the different teams that are involved in compliance in a way that gives us oversight and accountability across the entirety of the program. When you're thinking through this, if you are a newbie to compliance, a lot of this can sometimes be overwhelming. But the risk assessment really becomes a great thing to ground yourself against, because if you're saying, oh my goodness, I literally don't know where to begin, doing and kind of organically going through that process of completing a risk assessment is a great place to start, because that'll inform you on where your gaps are in compliance, so you can then review and prioritize from there. Okay. Other folks sometimes like to begin with policies and procedures and training and make sure that they're shoring up those gaps to begin with before they go to the risk assessment. That's also a great approach to take. However you do it, break this down into bite-sized chunks for yourself, but make sure that you're doing it in a way that is not disconnected. Okay. The ideal goal here is that your compliance program is holistically connected in a way that is easy for you to report on and illustrate your efforts. That's going to be of utmost importance. And so our recommendation is that when your compliance program is established, there's almost like a life cycle that you should find yourself following, where we're conducting internal risk assessment and internal auditing on an ongoing basis. We're actively identifying where our gaps are and documenting how we're remediating those gaps. We'll talk about that a bunch in just a minute. But that should then always bleed through into the governance of your internal policies, your procedures, your trainings, how you interact with outside vendors, how you handle incidents. All of those things come into play. And if that's not your situation, right, you want to be thinking about, how can we get to this type of a place? And so knowing we had some comments coming in that the window is a little bit small, you should be able to put it into full screen mode. I have it as big as it can get on my end right now, and I'm sharing the full screen. So if you refresh your tab and then make the screen full, you should be able to see it a little bit better, ideally. Okay. So with that said, we're going to move into the next segment here. We're going to talk a little bit about what does a HIPAA audit specifically actually look like? What types of questions would the government ask you for? What can we learn from that before we go into the practical fine examples? Before we do that, I'm just going to see if we have any outstanding questions here. So Yvonne, you asked, the 7-element slide is specific to privacy and security compliance. So a lot of what we're talking about today is going to be privacy and security compliance related, but the 7 elements is a very general standard published through HHS and the OIG that is used to govern any aspect of the compliance program that you could be dealing with. Okay. So in thinking through this, think about 7 elements as like any compliance standard that you're working with. The 7 elements is what you should be thinking about. All of those requirements apply regardless of the compliance standard we're talking about. Okay. So I'll come back to some more questions in just a little bit. Again, in this segment, we're going to actually take a peek at an actual OCR audit. But before we go there, there's a few things that I wanted to cover related to some data breach trends and statistics, because the overwhelming majority of the time, the reason that you get audited by the OCR is as a result of a breach or an incident, or an employee files a complaint against you. Okay. So when we look at all the sources of those breaches, hacking and IT incidents represented roughly 80% of all of those reports. People hear a statistic like that, and hacking or IT incidents can sometimes be like, well, what does that actually mean? How does somebody actually hack me or get into my system? And to be even a little bit clearer, The overwhelming majority of those hacking and IT incidents happened as a result of something like a phishing scam that one of your employees fall for. So one of your employees gets an email. It looks like it's coming from one of your internal systems. They click on it, they plug in their login credentials, and now a cyber predator has their login credentials to get access to your internal systems. Okay. That is the overwhelming majority of what happens the majority of the time in a hacking or an IT incident. Even further, though, the overwhelming majority of the breaches that happened last year, it was identified that it wasn't the covered entity or the healthcare provider themselves. It was a vendor that they were working with. And a lot of this is becoming more and more frequent, especially as people move to cloud-based systems. Because before, maybe you had a local server that you were responsible for maintaining. And so all of your PHI was in your actual facility. Now what's happened is all of the stuff gets outsourced to other vendors, and there's so many cloud services that could potentially have access to your patient's information. The governance of your business associates or your vendors we're seeing is becoming a huge hot button topic as far as OCR enforcement is concerned. I want to highlight that here to start because vendor related risk is going to come up over and over again as you hear us talk through some of these real world case studies. Okay. Now, few things as far as these enforcement trends are concerned is risk management after the risk assessment is always one of the biggest deals, meaning if you have proof of a risk assessment being done, that is great, but it doesn't mean much unless you could also prove how you were fixing the gaps that were found in your risk assessment. What many of you might have is a risk assessment that was done for you maybe by a third party or that you did yourself internally on a spreadsheet, but that assessment is borderline incriminating because all that it's doing is documenting where your deficiencies are, not documenting the efforts that you're making to fix those gaps, right? Or the good faith effort that you're making as you're remediating them. And so you'll even see this as we go through this audit. I'm going to laser in on a few of these questions, but this is a copy of a real OCR audit that one of our customers received. There was roughly 20 questions asked of them. And I'm going to laser in on two of these just to start, but to set the tone and kind of the brief explanation here. This audit happened as a result of a breach that the customer had. And they asked about the circumstances that gave rise to the breach. But then question number 2 is always 100% of the time in the event of an OCR audit, they're going to ask you for a copy of your enterprise-wide risk analysis performed on or after or prior to the incident. Okay. The risk analysis is kind of synonymous with risk assessment for our purposes today. Okay. Now, the ask for the risk assessment is immediately followed by question number 3, which is, okay, so you have proof of an assessment. Now show us evidence of what you did to fix the risks that were found in that assessment. And it even says identified in the risk analysis reports referenced in number 2. That is where people frequently have a big challenge. And then as you go through the rest of this OCR audit, roughly 8 of the 20 questions that they ask contain specific asks around policy, procedure, and training. So out of 20 questions, you have 2 that focus in laser focused on that risk analysis piece. Show us you did a risk analysis. Show us what you did to fix those gaps. Another 8 questions then asking about internal policy, procedure, and training. The rest of the questions are more practically like, what steps did you take to fix the breach? Who was notified? All of that sort of stuff. But as it concerns your compliance program, that risk assessment, how it bleeds through your remediation efforts, down to your policies, procedures, and internal employee trainings, you're going to hear me talk about this a lot because it's something that I find to be so important and so essential across the board is that these things cannot be disconnected from each other, right? This type of an audit comes and people fail it, not because they're not doing these things, but because to the government, it's not a matter of what you're able to prove on paper, or I'm sorry, it's not a matter of what you're doing in practice. It's a matter of what you're able to prove on paper. right? And showing that flow from risk assessment to remediation efforts to your policies, procedures, and employee trainings and how you're governing that holistically is absolutely essential in order to defend yourself if there was an OCR audit. Okay. Another key trend that we've noticed, which has been for the last many years, is on the privacy side regarding patient right of access enforcement. This is for 2 years in a row. If you go back a little ways, this was the number one reason that organizations were actually being fined was due to right of access violations, meaning I'm a patient and I request a copy of my medical records, and my medical healthcare provider does not provide me with those records in a timely manner. You can get in a lot of trouble for that now. We'll cover that a little bit more as we look through some of these examples. Okay. With all that said, we want to get pretty tactical here and actually start covering some of the fines. I'm just taking one more peek to see if there are any additional questions that we have. Yes. So, Mindy, nice to hear from you. You had mentioned 70% come from BAs. Yes, that is the accurate statistic as of today from healthcare data breaches in last year. And the thing that I often say to people regarding that stat is you think about just where the data lives. Virtually none of the data anymore is contained in the medical practice or the covered entity themselves. Doesn't mean that the covered entity is not at fault. We'll talk more about that as we go through, but it means that the BAA was seen as the BA was seen as the point of failure. That often happens. Okay. Just going through some of these questions, and again, folks, you can upvote these questions as well. Okay. Somebody asked, just to clarify, the audit being discussed is an actual OCR investigation. Yes, so that's an actual OCR investigation. The OCR audit program is a separate process. Yeah, so that's referring to an audit one of our customers received as an initial data request following a breach that they had. Okay. I'm seeing a few other questions. We'll circle back to these. And again, if you have a question and you're sending it in the chat, we have a lot of people in the chat today and I might not see it. So make sure you're using that Q&A feature. 2025 healthcare fines. So let's talk through some high-level summaries that we can learn from the enforcement actions taken. One of the more interesting ones to me is that with each of these fines, there's also a corrective action plan that the OCR issues. There's many of these corrective action plans that they issue, often without a fine. They typically publish the ones with a fine, okay? The average corrective action plan lasts about 2 to 3 years in the event that there's a settlement with the OCR. That to me is almost worse than the fine, okay? So more than just having to pay the money to the OCR when you're found in violation of a HIPAA rule or things like that, it's the fact that you then have them overseeing you for this 2 to 3 year period where they continue to follow up with you in all of the steps that were outlined. This past year had the highest annual total of fines that we've had since 2020. The average settlement was about $400,000. We talked about this a little bit before, but most of these cases were triggered by things like phishing scams and ransomware attacks, a lot of security issues and breaches. And you'll even see that 81% of these were security rule violations. Only 19% were privacy rule cases related to right of access. But we talked about that stat before, where 70% of the breaches, the business associate was identified as a point of failure. I want to highlight still that that doesn't negate the covered entity's responsibility, because even still, 71% of the entities that were fined were covered entities and about 29% were business associates. Because even if the business associate was seen as the point of failure, there could be tons of things that you're doing internally that could cause one of your systems to be compromised, let's say, right? So be thinking about that, okay? And I'm seeing a comment from Igor. Thank you for joining, Igor. So you said, how is it fair that small medical practices are to be held to the same standard as large healthcare organizations that have large IT departments? So it's a very fair question. I think that this question drives at why the HIPAA rules have some intentional gray area or a little bit of vagueness built into them. They have published a lot of very specific guidance that's designed for small healthcare organizations as compared to the larger ones. So don't think that like the small ones are held to the same standard necessarily that the large ones are, but you're still expected to satisfy the same types of requirements, right? Meaning, whether you are small or large, you need to do a risk assessment. You need adequate policies and procedures and trainings. You need IT infrastructure. You need to be vetting your vendors. You need to be handling your incidents. But the practical outworking of that, there's even like the SRA that HHS publishes for security risk assessment is designed for smaller organizations, right? So there's different ways that you could think through that. I'll say like this does tend to be a burden for smaller companies, but I think unfortunately, that is causing smaller companies to be more or less a primary target of the OCR's enforcement initiatives as of late. Okay, so lesson number one that we have, you'll see that there's a bunch of these fines that we list here: Elgon, NPN Solutions, Northeast Surgical, Comprehensive Neurology, Vision Upright MRI. Every single one of these was 50 employees or less. Okay. And the OCR, following many of these fines, specifically published commentary saying that, like, listen, small providers also must conduct accurate and thorough risk analysis to identify potential risks and vulnerabilities. Does that mean that your environment is going to look identical to a large healthcare organization? No, but it does mean that you need to still be doing that assessment to identify what are the risks in your environment and how could you be mitigating them. And I think unfortunately there's this mentality often among smaller practices is that we're a small practice, so like what makes sense for us is to do two of the seven elements, right? And I'm going to come back to that. But really, all of those things are universally applicable, whether you're large or small. It's just how you implement them into your environment is going to look a little bit different. And we are seeing now that roughly 1 out of 3 entities that entered into a settlement agreement with the OCR had 50 or fewer employees. That number continues to go a little higher every single year. It used to be that the OCR had bigger fish to fry. But what I want you to imagine is that because you as a small practice don't have as much resource as a large health center, you become a target for the cyber predators. It's not just that you're a target for the OCR, it's that you're seen as an easy point of entry for a ransomware predator or for somebody to perpetuate a phishing scam because they know you're not going to have as much infrastructure as one of those larger companies. So we see that happening more and more. Lesson number 2 here is that like many of these violations were easily avoidable. I'm going to say maybe like an ounce of prevention is worth a pound of cure, to use that more traditional saying. And you'll see again, a lot of the things we highlight here, coming back to the same things around general typical failures that were cited across the board in many of these fines, is just not doing the security risk analysis, not fixing the risks that you identified, or something as basic as not providing the patient with access to their records when they asked for it, right? In here, you see a specific case. The organization is called PIH Health. They had a phishing scam that actually compromised 45 employee email accounts. Nearly 190,000 individuals were affected in this breach. Exposed social security numbers, medical records, financial info, treatment details. Healthcare information, and so healthcare as an industry right now is the most breached sector of the US economy because the information that you have about your patients is typically extremely valuable. Okay. And for those of you that have been tuning me out here for a little bit, I want you to pay attention to this just for a second. If somebody steals my debit card, okay, that is maybe a quick transaction and I'll notice it and shut it down, or my bank will flag it for me. If somebody gets my full healthcare record, that can be used for blackmail, could be used for identity theft, insurance fraud, any number of things. And so a typical healthcare record is sold in the black market for anywhere between 5 and 10 times more than financial information. So you need to understand that like there is a logic here to why the smaller entities are being targeted and to why the OCR is focusing on these types of settlements. Because in this case, this company was found to not have done a risk analysis. They were not doing phishing training with their employees, again, connecting the dots down to training. And they were also dinged for remediation and risk management efforts associated with all of that. Okay. So, all the way downstream, you see these same things happening over and over again, but it's all connected, right? Almost every enforcement initiative that you could look at maybe cited things like the risk assessment as the basis for the enforcement action. Every single corrective action plan, though, from last year, like 9 out of 10 of them, basically, specifically target training and policy and procedure as being a key part of the OCR's corrective action with that organization. And this is one of those things where, depending on what your role is within the company, we speak with a lot of people where compliance was a role that was given to them basically because they drew the short straw, right? Or maybe you're in like an office manager type of a role, and surprise, you were made responsible for compliance, right, by the doctors that are over you. Happens all the time. And one of the things that I would encourage you to be thinking about is not just compliance as it concerns like the checkbox exercises within your environment, but how can you do this in a way that actually changes the behaviors of your employees? Because ideally, good policies and good training, when implemented effectively, change the culture of your company and actually adjust the behaviors that you're trying to adjust for. Meaning, your training should ideally put your employees in a position where they can quickly recognize a phishing scam if it takes place. Your policies shouldn't just be very basic, plain boilerplate language. They should be tailored to your environment, and your employees should be encouraged to reference them for your actual processes. And when you're doing your risk assessment, you should be evaluating the effectiveness of those policies to determine, is this actually the reality of how we operate? Like, is what is in our policies what is actually taking place in practice within the organization? If that's not what's happening, then the policies don't mean anything, right? And you're going to get in trouble when the OCR comes in and they're asking you for your policies, but then they're evaluating your practices in practice and it doesn't line up, right? It has to line up. And so key learning here is that like those types of compliance trainings policies, this only works if it's simple, engaging, and persistent, like not crazy long technical or one and done trainings that you wash your hands of once a year that everybody sits and listens to and they're scrolling through their phones. It has to be something that's making an impact on the culture of your company. And you'll see in here these two cases. Both cases could have been prevented with clear training on things like breach notification and breach response requirements, and just basic training on right of access rules. Like Concentra was fined $112,000 because a patient reported them for not providing them with their medical records. If they had a clear process and policy and a training that their employees were following, that should never have happened, right? So that's what we're talking about when we say like, it should not only be in place as a checkbox, it should actually be governing the behaviors you see in your practice or in your business day to day. Okay. Next thing that we're going to go is we're going to talk a little bit more about the vendor requirements, but I see some great suggestions here in the chat. So Kelly, and again, folks, I have such a cursory view of the chat because there's a lot of these coming in, so I cherry pick a little bit. But Kelly, you said you should check state-specific right of access timeframes too. Sometimes they are less than 30 days. That is a fantastic call out. So the 30-day timeline is a federal expectation. Some of the states vary, so make sure you're familiar with those state-specific guidelines as well. But Igor, you asked, have you seen situations where practice did all the internal audits, they got hacked, and the government fined the organization anyways? You could still do everything right and still get hacked for no fault of your own. I absolutely love this question because it drives at what the OCR is looking for. Okay. It's not about being bulletproof, right? Even the US government themselves gets hacked. You will never be fined for getting hacked or for having an IT incident. You get fined because you can't prove that you had some element of an effective compliance program. Okay. All of these OCR settlements, they're not saying, hey, $100,000 fine because you got hacked. They're saying this is a fine we're levying because we identified that you were being negligent. You didn't do the risk assessment that was required. You didn't train your employees on those topics. You didn't implement the right policies, right? It's not a matter of eliminating risk. It is a matter of mitigating it, right? And showing and illustrating good faith effort in the eyes of a regulator. That documentation of your efforts is what matters most. It's not a matter of being truly bulletproof because you can't be, right? Not even the US government is. So I am looking through just a few extra questions here before we move into some of these final elements. So somebody asked, should you have an AI statement in the BAA? I don't believe HHS has published a ton of guidance around BAAs and AI tools. I'm not sure if there's like specific statements that they recommend you including in them. Maybe something worth seeking legal counsel for, though, especially if you have AI systems and tools embedded in your processes. Worth understanding the implications there as far as who is getting access to your data and how you're handling it. Okay. Somebody else asked, business associates is where I feel we are lacking in our contract with them. Will there be discussion on how to shore up those issues? We are a small organization. Thank you for the question, Lisa. Yeah, let's tackle this now. So you'll see that lesson number 4 is that vendors are a primary compliance risk. A third of the HIPAA fines were against business associates this year, and 70% of data breaches found that the BA was a source of failure. Okay. Frequently, and you'll see these 2 fines here that were actually against BAs. We have a lot of vendors frequently on these webinars. So I'll say this. Number 1 is that if you are on this webinar and you are a business associate or a vendor, you need to understand that under HIPAA, you have nearly identical compliance responsibilities as your customers do as it concerns data security. And when I say data security, I'm not just talking about the security of the platform that you're selling or your internal environment. I'm talking about data security as it concerns your internal security policies and procedures, as well as your trainings, okay? Quite often, that is where you see a lot of companies get in trouble, is because they think, oh, well, we have a secure IT system, but if you don't have, but you have people that have access to the data in those systems. And if you don't have policies and training that are governing that, you can have a problem. For those of you that are covered entities and looking at your vendors, any vendor that you're engaging with that has access to your patient's information, you absolutely need to have a BAA in place, okay? If you don't, that's a big problem, okay? Because by default, okay, the fines that we've seen levied to companies that had a breach and it was identified that they were missing a BAA, you will get fined just by default for not having the BAA in place. Other sources of negligence can sometimes be a little bit more complex, but thinking through your risk profile here, it's relatively simple to review your vendors, figure out who has access to patient data, and make sure that you have a signed business associate agreement in place with them. Main thing that you should be thinking about here, you should also be asking your vendors some questions to ensure that they're actually safeguarding the data that you're giving them access to and that that's documented, right? Ask your vendors if they're HIPAA compliant. Ask them about their processes as it concerns internal policy, procedure, training, and data security. It's all really important because if one of your vendors has a breach and it's your patients, the government will still most likely ask you questions about it. And so you'll need to show those efforts that you undertook to protect yourself. Okay. Those vendors need to be managed. Okay. They need to be treated almost like an extension of your organization, like what you'll see here. Asking those questions, holding them to a higher standard, Some of you might be like, well, how can I do that with Microsoft? How can I do that with Google? Those organizations are usually certified above and beyond what HIPAA would require for data security. So the presence of a BAA and the tracking, the following up of that relationship is usually sufficient. We get that question a lot. So we got 15 minutes left. I'm going to wrap this up somewhat quickly here so we can make sure that we get through a bunch more questions. But right now, as a concerns vendor, if there's anything that I would encourage you to do, part of the HIPAA risk assessment requirement is that you maintain an inventory of any vendors or third-party applications that touch or access PHI. Start there. Make sure that you have a BAA in place with them and do that basic vendor assessment when you're going through the contracting process. Ask them a series of questions similar to maybe what you would go through in your risk assessment internally, and make sure that you're re-reviewing that list of vendors at least on an annual basis. Make sure that they're confirming that they're doing their own assessments, that they're training, that they have breach response processes, because otherwise they could have a breach and not notify you of it, and it could have your patients included. Okay. So if you ask that question, this is the slide that I would encourage you to take a screenshot of. Grab this down and use this as a reference for your vendors going forward. Hacking and the importance of training. Roughly 95% of all data breaches have a human error component in them. I talked about this before, but you can't solve risk if you're not solving for your workforce compliance needs. Let me adjust my screen here so everybody can see this, okay? Risk management and workforce compliance management are the same thing, okay? You are not adequately managing your risk if you're not managing workforce compliance needs. Frequently, that is an area that gets very siloed, where, oh, well, we have our risk team, we have our IT team that's doing this, HR does training, I handle policy, I handle incidents when they occur. Those things have to be coming together to a certain degree in order for you to actually have a robust risk management strategy, something that you should be talking about internally if you're a large organization. But also for those of you that are small, what this means for you is that you can mitigate most of your risk with a good amount of training for your employees that covers topics like cybersecurity, HIPAA privacy basics. Ideally, cybersecurity training is something that you're doing on an ongoing basis. You'll see these stats here, which is that like roughly 50% of employees haven't received training across the healthcare industry for phishing specifically. And 71% of new hires are likely to fail for phishing without training, okay? Even basic things like this, make sure that this is happening in your company, that it's not a checkbox exercise, that it's something that's simple and engaging and effective for your staff. We got a few insights here from some of our experts. One of our customers, Dottie Bollinger, has worked with us for a long time, and something that she brought to the table, which is interesting as you look at ADA compliance standards, is that a lot of the ADA's compliance standards is moving towards not just general disability accessibility, but actually digital accessibility, meaning that pretty soon you're going to be held to the standard where your patient-facing websites, portals, and mobile apps need to be accessible, meaning if I'm a blind person, your portal needs to be set up in a way that I could easily access it and review my records, right? That type of increased scrutiny on disability access and patient communication, we talked about like HIPAA privacy, right of access. Same applies, I think, in the government's mind. It's like, if I'm a patient and I request my records, I have a right to access that. But if I'm a patient with a disability, I also have the right to access those records in a way that is accessible to me specifically, right? So we see a lot of that type of stuff coming down the pike. And one of our internal counsels here, Dan Lebovic, also highlighted that risk management just continues to be a top OCR enforcement priority. We're seeing more enforcement on this than ever before. I think part of the reason for that is actually that the Department of Justice released a report against the OCR last year. or a year and a half ago, saying that they weren't doing enough, basically. Like, you're not doing enough to mitigate the risks that our people have, or that our healthcare organizations have. So they significantly upticked on how they're enforcing things like risk analysis. All of the tips that we gave you today will ideally help you mitigate those types of risks. The OCR is even calling it their risk analysis enforcement initiative, and we see that continuing. But what all of this means for you is that while enforcement is escalating, most of this is preventable with a few simple steps that you could be taking within your environments. Um, Especially if you're a small to mid-sized practice, again, this can seem overwhelming. We want to just be as helpful and practical as we can. Make sure that you're reviewing your policies, procedures, and training, that you're completing a HIPAA risk assessment on an ongoing basis and re-reviewing it and documenting the efforts that you're making. But understand that all of these things are connected. The risk assessment means nothing if it's not connected to your internal processes with your employees and how you handle incidents and how you interact with your vendors. And so we're going to say it again, workforce compliance management is risk management. And if those two things are not being done together, you could be in trouble. So for those of you that are watching this, thinking through, like, again, you're maybe feeling like a little overwhelmed, if you're, especially for those of you that are smaller businesses, we want to make an offer for you here to meet with our team and do a completely free compliance risk check with our team here. You'll actually see in the upper right corner of your screen, there's an option that says schedule time with our team. Super low pressure conversation. Our team here is awesome. And I think their goal in these conversations is to meet with you, maybe talk for 15 to 20 minutes and go through a few of those key needs that we were discussing today, and ideally make some recommendations for you based on your unique environment of how you can be doing that maybe a little bit differently, or suggestions that we can make to tweak your process. This is completely free for you to schedule this call. So I would encourage those of you that are sitting here and maybe just feeling very uncertain about where you go next, please, whoever wants to, schedule that time with our team. I think you'll find it's an awesome conversation and will be just a great way for you to dialogue with somebody and work through some of these needs. Thank you, Bradley, for the recommendation there. Bradley said it's been a client for 3 years and we make compliance so much easier. That's what we love to hear. Okay. So please click that link, schedule some time with our team. And for those of you that are interested in becoming a Compliancy Group customer, you may not know much about Compliancy Group. Literally everything that we talked about today can be tracked and satisfied and addressed in our software platform, which is called the Guard. Okay. We have plans that are extremely affordable, designed for both small practices all the way up to larger healthcare institutions. If you are one of the first 10 webinar attendees to sign up with us, we are going to throw in our audit response program completely for free. Okay. What that means is that if you are subscribed to Compliancy Group and you get audited, we will directly be involved with you in managing your response to the OCR. We have never had a customer fail an OCR audit, an investigation, or be fined in the history of our company. So if you're interested in taking advantage of that, go ahead again, just click that schedule time with our team option. Schedule that call with our team and let them know that you're interested in taking advantage of that free audit response offer. They'll happily walk you through all of your options with us. Okay. Will the link be available with the recording? Yes, we will send that out to everybody afterward. Janetta, you asked, what about EEOC? We actually have modules in our platform built to cover everything from HIPAA to OSHA to EEOC. You could use us for any custom compliance needs, for HR compliance needs. It's really meant to be an all-in-one compliance solution, not just addressing the topics that we're covering today. You can get really broad with this. So again, if you schedule that time, let them know that you're interested in taking advantage of the webinar offer. We're happy to offer that to the first 10 people who sign up. We can't give it away to everybody because we'd be losing a lot of money. So whether or not, take advantage of that, meet with our team, do that risk check, see what you think. I'm going to go through now and just tackle a few questions that I'm seeing here. So let me take a peek. Would you please address the patient receiving records in behavioral health and substance abuse disorder environments? So, Fern, behavioral health has some unique implications as it concerns patient right of access because the privacy rule actually gives extra protections on your therapy notes. Okay. Meaning, like in your EHR, there is ideally a separate section where you can document therapy notes separate from the rest of the healthcare record so that if your patient requests a copy of their records, your sensitive notes and documentation from your conversations with that patients do not need to be provided to them. Those have extra protections for you in the privacy rule as well. Okay. Those are specifically referencing psychotherapy notes. So if you even Google privacy rule psychotherapy notes, there's a policy that we could provide you with as well that tackles those topics, Fern. So if you're interested in that, feel free to speak with our team about it. Okay. Somebody said, can you elaborate on employee training requirements? How often does this need to occur? It is not clearly defined. So you're exactly right, Brandy. It's not clearly defined in really any of the government documentation as far as what you actually need to be doing for things like employee training. At minimum, though, what the government says is that employee training should be ongoing. Okay. The once a year rinse and repeat annual training is generally not going to cut it any longer. Our recommendation is you should have a once a year training that is like deeper focused regulatory topics covering things like HIPAA, fraud, waste, and abuse, OSHA, your HR trainings. But periodically throughout the year, you should also be distributing short refreshers, especially for things like cybersecurity, which is governed under HIPAA. Once a quarter, if there's like a short training that you're sending to your employees as a reminder for things like phishing, for ransomware, for cyber risk, these things are ever evolving, especially with AI. So making sure that you're staying up to date on that, that type of an ongoing approach, we think is really important. Okay. So Mary asked, when you say emergency procedures, is this the same as handling a breach? There could, I mean, broader compliance, there could be many, many different types of emergency procedures. With what we were talking about today, that might be your actual incident response processes and your breach notification policies and procedures, right? People should know internally, what do I do if we think we had a breach? Who do I notify? How do I notify people if a breach occurred? All of that stuff that should be easily accessible to them, and your policies should also be something that you're training on. We answered a few of these as we went through. Somebody asked, if the company credit card is hacked, is this considered a breach? It's a breach of your company's financial information, hopefully not a breach of your patient information. So I would say it's probably not a HIPAA breach, but still something that you would want to handle. It would just maybe not have HIPAA implications, Rebecca, because it's unlikely that your company credit card would have patient data associated with it. Do you have any advice or input on the use of healthcare virtual assistants? So we actually have many VA companies as customers here at Compliancy Group, and I'll say that there is a unique risk profile there. The biggest one being that you are working with this outside entity that is providing you with somebody that's essentially functioning as an employee. So number one, BAA has to be in place with that outside entity. But ideally, your virtual assistant, you should treat them as a workforce member and have them sign off on your policies, procedures, and attest to your trainings, go through all of that same stuff that an employee would. Just gives you an additional layer of protection where the BAA might not be enough because that's governing the entity. That individual that's operating in a very deep way within your business, you should be treating them a little bit differently. If time allows, would you provide your thoughts on the recent Epic and Health Gorilla litigation? What should a covered entity do when Epic is stating fraudulent access and Health Gorilla is denying these allegations? I would not want to weigh in on that for this webinar, Maria. Um, I'm familiar with it, but I have not looked at it deeply enough to give my take one way or another. I'll say, like, when you have two big titans in the healthcare space like this that are running up against each other, sometimes it can have some helpful lessons, but other times a lot of it for the majority of like our customers, it just might not be as applicable, right? So because let it's just going to be a little different. So might not want to weigh on it for this session. And we are at the top of the hour here, folks. So I'm not going to be able to handle more questions. Thank you to everybody for such thoughtful questions. Thank you very much for joining the session today. We so appreciate this. If you have any feedback for us, let us know what you thought of the webinar today. If it was good, if it was bad, if there was suggestions that you would make. Again, we had a lot of people on this session, so hopefully you all had a good experience here today. And if just last opportunity, if you click that button up in the top right of your screen, it'll take you to a scheduler where you could schedule just a zero obligation time with one of our team members. And I'll get involved in whatever conversations of those that I can. So we would love for you guys to take advantage of that. We hope that this was a great session, that you got a lot out of it. We so appreciate everybody's time. All right. Thank you so much.